I'd like to welcome everybody to the meeting tonight. I'd like to welcome Dr. Todd Cade from Washington University, St. Louis, to provide us with an overview about the research project that he has that has been funded by the NIH. Again, this call is being recorded. I've muted everyone, but you can type your questions down in the chat section of your GoToMeeting control panel, and we will make sure that those questions are asked. And if you have a question that has not been asked or you have something that you'd like to say, I will unmute you and then you can ask Todd your question, Dr. Cage your questions. Todd, thank you for doing this tonight, and let's just move on forward. Thank you.
Great. Well, thanks everyone who were joining and want to hear about this study. So I think some of the questions were last time, which study is this? Because we've been doing a number of different studies, and it's unclear which study that I'm going to be talking about tonight. So this is not one of the exercise studies. This is a study examining the effect of metabolism on heart and skeletal muscle function and Barth syndrome. So basically, this is kind of the coup de grace study that we've been working up towards. I received a grant a few years ago from the Barth Syndrome Foundation to gain some preliminary data on heart and skeletal muscle metabolism. When we talk about metabolism, we're talking about how these tissues use glucose or sugar, fat, and amino acids for energy, and how that affects the function of these tissues or organs. So that was instrumental in actually gaining some preliminary data to then apply for a NIH-funded grant, which is this, and we were fortunate enough to be funded about a year and a half ago for this much bigger study, looking at the role of metabolism, glucose, amino acid, and fat metabolism in heart and skeletal muscle metabolism. So basically, that's what I'm going to be talking about tonight, just so to clarify that. So as you see from the title, it's heart and skeletal muscle metabolism, energetics, and function in Barth syndrome, and I'll explain how we plan to look at that. So first question is, why are we doing the study? So the big answer to that is we don't know everything about this disease yet. We don't know the full effects of the tafazin gene mutation. We know that this much is it disrupts cardiolipin metabolism, especially in the mitochondria, and that affects mitochondrial structure and function. But we don't really know the full effect of tafazin on glucose, fat, and amino acid metabolism, and how this affects skeletal muscle and heart function. So again, we received some preliminary funding from the Barth Syndrome Foundation that we found that skeletal muscle metabolism of amino acid metabolism in particular was dysregulated in Barth syndrome. And there's some data from the mouse model of Barth syndrome that amino acid metabolism also is abnormal. And we found some associations with these abnormal amino acid metabolism and heart function in the Barth patients from the Barth Syndrome Foundation funded study. So the purpose of this study is really to examine the causes and contributing factors to heart failure and muscle weakness in children's, adolescents, and young adults with Barth syndrome. So during the study, we plan to examine how children, adolescents, and adults metabolize fat, sugar, and amino acids or protein, and how and if it's related to the heart and skeletal muscle function. So hopefully, we're hoping that information collected from the study can help us really fully understand the disease and the causes and contributing factors to heart failure and skeletal muscle weakness in Barth syndrome. So we are recruiting children, adolescents, and adults with Barth syndrome. So the youngest, we'll talk about the inclusion, exclusion, but we're recruiting children as young as 8 years old with and without Barth syndrome. So we're looking for healthy controls as well, so siblings or friends of those with Barth syndrome. So basically, what will happen if you decide to enroll in the study? So if you're a child or adolescent, so anyone younger than 18 years old will participate in a 2.5-day study, and if you're an adult, you'll be asked to do 1 extra day of study, so it's 3.5-day study. So it's a fairly time-intensive study. Obviously, if you live outside of St. Louis, which most everyone does, you'll be asked to travel to Washington University and stay at our local hotel, which is located right on our campus, 3 to 4 nights, depending on when you come in during the study. So we pay for all travel, including flights, cab fare to and from the airport. We pay for study meals, and we pay for the hotel stay while you're here. So we make things as easy as possible as far as costs go. And all the testing and procedures that we're doing are for research purposes only. So we will be paying for all of those, so you're not responsible for any of these costs. So specifically, what will happen during the study? So once you arrive, the night before, we ask the research participant to eat a study meal provided by us. So basically, we want everyone eating the same amount of calories based on their weight, the same percentages of carbohydrates or sugars, the same percentage of protein, the same percentage of fat. So when we look at your metabolism the next day, everyone is starting from a similar place as far as what they ate the day before. Then we'll ask you to fast from about 10 o'clock that night until the next morning. And the first day, again, depending on when you get into St. Louis, you're going to do a graded exercise test. And I know most of the guys have already participated in one of these at one of the conferences. So it's basically riding an exercise bike. It takes about 8 to 12 minutes. You're hooked up to an EKG, and you're breathing in and out of this snorkel-like device that measures your oxygen consumption. Again, that procedure takes about, once you start pedaling, it takes about 8 to 12 minutes. Second day, which is really a full day, you'll get a body composition analysis. So basically, this measures how much fat you have on your body and how much lean tissue. And I don't know, I'm probably dating myself, but I don't know if anyone remembers Mork and Mindy, the sitcom he used to be on. It looks like that pod device that he traveled from space in. So basically, this body composition machine is called a bod pod, and it's done through air displacement. So you basically sit in there with a swim cap on. It takes about 7 minutes. It just uses air displacement to measure your body composition. So it's just non-invasive. It doesn't hurt. So it's pretty easy. We draw blood for sure, and then we do a 3.5-hour nutrient metabolism study. And I'll explain a little bit more what that is. But basically, we infuse a little bit of fat, a little bit of sugar, and a little bit of amino acid into your body through a catheter, and we take repeated blood samples through a catheter, and we can measure basically how much fat you're breaking down, how much fat you're utilizing for energy. Same with sugar and amino acids, so we can tell a lot about your nutrient metabolism during this study. We also do a magnetic resonance imaging scan, or MRI, of your heart and skeletal muscle. And so instead of taking pictures of your heart and skeletal muscle, we're able to measure the energetics, or how your heart and your skeletal muscle is using nutrients for energy. We also do an echocardiogram, which I know everyone has undergone as well. And then the day 3 procedures is the exact same nutrient metabolism study. We just use a little bit different. So one day we infuse amino acid only, and then one day we infuse sugar and fat. So just same deal, 3.5 hours, taking repeated blood samples and breast samples during the study. And then on day 4, this is adults only. It's a pretty much a full day scan. It's a heart metabolism imaging study, or a PET scan. So instead of looking at whole body metabolism or skeletal muscle metabolism, we are looking at specifically how the heart utilizes fat, sugar, and protein. And we infuse a little bit of radioactivity isotopes, so we can measure how the heart is utilizing these nutrients. And this is done clinically, especially in the cancer realm. If someone is looking for cancer, this isn't going to look for cancer, but this is a similar procedure that is done routinely every day clinically to look for the presence of cancer. So Jack already gave me permission a long time ago to use his pictures in any advertisement. So this is Jack a number of years ago in a study looking at, so you can see here, I don't know if you're going to be able to see my cursor here. These are the stable isotope infusates that are being hung. Here, we're infusing, right? This is a fat right here, a little bit of fat. This is a little bit of protein and a little bit of sugar. And as you see, this device here is a hot box, or a warming box. It basically, his hand is in there. It just makes it easier for blood draws. And this crazy looking device is called an indirect calorimeter. Basically, it measures how much carbon dioxide the participant is expiring, and we use that in calculations of how much fat he's burning or oxidizing, or how much amino acid he's oxidizing. So we basically put this hood on for only about 15 minutes at a time periodically through the study. This device here is a breath collection device. So a couple of the tracers have a label on it that when you burn it or oxidize it, the byproduct comes out in carbon dioxide, and we can collect this through these little tubes here in his expired breath, and we can put it on a machine called a mass spectrometer, and we can then determine how much fat he's oxidizing or burning, or how much amino acids he's oxidizing or burning for energy. And he does this periodically throughout the study. It takes about 1.5 to 2 minutes each time that we collect these samples. This is a picture of the heart scan. This is an old picture. This is not quite as big as it used to be. Our coil is much smaller now. But basically, this is the MRI device, and we look at heart energetics and also skeletal muscle energetics of his calf. And each scan takes about 40 minutes a piece. So if anyone has claustrophobia, we can certainly either stay in there with the participant, or if it's bad enough and they don't want to participate, that's okay. We can exclude this part of the study. So this is a picture of the exercise test. Again, many of you have probably participated in this in one of the conferences over the past few years, but this is the exercise bike ergometer here. He's hooked up to the EKG machine, plus he also is breathing in and out of the snorkel-like device that measures his oxygen consumption. And again, this test takes, once we start it takes about 8 to 12 minutes. So how many people are we looking for? So we are looking for a total of 60 participants over this 5-year study. So we're about almost 2 years into this study. We're looking for 15 children, adolescents with Barth syndrome, ages 8 to 17 years old. So if you have a child that's 5 or 6 years old, because we're going to be doing this study for the next 2 or 3 years, it's possible that that child will turn 8 in the next couple of years, and we'll be able to study them as well. We're also looking for 15 children and adolescents without Barth syndrome, so non-affected friends or siblings of those with Barth. We're also looking for 15 adults with Barth syndrome, ages 18 to 35 years old, and then also 15 adults without Barth syndrome, same age. So we're looking for adult controls as well. So the total amount of participants we're looking for is 60. So currently we're not enrolling those with heart transplants, and the reason why we're not doing that is because we're looking at the relationship between metabolism, nutrient metabolism, and heart function. Because those with heart transplants, it's really hard for us to make a good determination of whole body metabolism or heart metabolism in those with heart transplants and function. So as of right now, we're not enrolling those with heart transplants. We began enrollment in the spring of 2013, and like I said, we're going to be, this is a 5-year study, so we're going to be ongoing until the spring of 2017. I guess that would be, yeah, that's about right. Okay. So many questions are, what are the risks associated with this study? Well, the common risks or likely risks are minor discomfort or bruising, bleeding, soreness, chance of skin infection or blood clot, with the insertion of needles in your arm veins. And this is typical anytime you get blood drawn. This is the risk you're going to encounter. You might get bruising or some discomfort from the needle sticks. You could also get muscle soreness of the legs from the graded exercise tests and exercise sessions, as many of you might have experienced with participating in the conferences at the hotel. And then the adults only will get a small amount of radiation from the radioisotope and PET scan. Again, that's the adults only, so the children don't get any radiation, but the adults will get a small amount of radiation. So less likely or less common risks, the insertion of the IV tube for blood drawing may be associated with a small risk of bleeding or infection. There's also, anytime we infuse anything, there's a small risk of the IV dislodging from the vein, and the infusion of the tracers go into the subcutaneous space of the arm rather than the vein. So if this happens, there might be mild swelling and tenderness of the arm. But we continually monitor that. That rarely happens. Another risk is participating in the study is in any studies that your confidential information will be accidentally disclosed, but we We only use patient identification numbers, so we refer to everyone as a basically an identifier, and your information is secure in a computer in a locked office. So we really do everything we can to not disclose your identity. We don't give your information to any insurance or any outside entity. And then there's very rare life-threatening events. So if you participate in the exercise testing or training, you can experience a life-threatening arrhythmia, which may lead to a heart attack or possibly death. There's also a very small risk of infection that can happen with the stable isotope tracer infusion, but everything is sterilely tested through the hospital pharmacy, so the risk of that is extremely rare. So what are the benefits of the study? So at this point, we really don't know. So this is not a clinical trial, so we can't say that by participating in this, you can get a direct benefit. But we hope that in the future, people with Barth syndrome may benefit from the study because we are able to use this information to help better learn about the causes and contributing factors of heart failure, and potentially, we hope it might lead to a clinical therapy in the future. So besides that, we will pay for all travel of the participant and one parent as well. Well, I didn't mention, we also pay for the travel of one parent to accompany the participant to come. So again, plane fare, cab fare, hotel stay. And then you'll also, in addition, be paid $300 US for children and adolescents and $400 for adults for completion of the study, or $100 per day, per study day. And again, you will not have any cost for being in the research study. So who is funding this study? The United States government or National Institutes of Health is funding this study. And I have to make this disclosure that I am not paid by the NIH, and I don't receive any extra direct payment or increase in salary for conducting this study. So how will we keep your information confidential? We will keep your participation in this research confidential to the extent it permitted by law. However, other people may be aware of your participation in this research, including the NIH if they ever were to audit the study, people in the hospital representatives, again, if they were to audit this study. We have a data safety monitoring board, which includes people here at the university, and also Barry Byrne and Carolyn Spencer, also on the data safety monitoring board as well. But as I said before, we assign everyone's study numbers, not by names, so really only people in the research team can identify you. And all data will be kept in locked offices and laboratories. So we have a research coordinator, Kay, which you, if you're going to come to the conference this June, you will meet. She's wonderful. She's great. She's my research coordinator. You can contact me as well. And we're currently enrolling, and we've enrolled, so I think we've enrolled 8 children with Barth syndrome and 10 control children, and we also studied 5 control adults, and we have a couple Barth guys, adults, currently scheduled to do the testing. So we can, we can certainly have them talk to you. Anyone who's participated in the study, if they're willing to talk to you and answer any questions that you might not be willing to ask me, to really get the participants' view of participating in a study, I'm sure they'd be willing to talk to you. So with that, I will answer any questions that you might have, and I appreciate your time to listen to me talk for the last few minutes.
Are there any questions? If anyone has any questions, just in the effort to try to keep things going as quietly and so we can hear your questions. If anybody has any questions, if you want to just type something in or let us know.
Todd, this is Matt. I just wanted to say thank you for all the work that you're doing. This work is essential for us getting anywhere with finding a therapy for Barth syndrome. And Todd is one of our very best researchers, and probably the only one that's really doing clinical research on such a scale on Barth syndrome. So I just wanted to put that out there right now, and thank him again, and thank him for the future, because this is, a long-term sort of project and essential to our efforts to try to find something find a treatment or a treatment for Barth syndrome. So just want to add that right now.
Well, thanks, Matt. I love doing it. I really, it's been the biggest joy in my career by far to work with this group. So,
Todd, one of our participants said that you've done a wonderful job covering the information and he has no questions. And I'm looking, and I have another participant who said this was very well explained, and they have no questions as well. Wow, you did a really good job, Todd. No questions. If anybody else has any questions, if you could just type your message into the chat section, we will make sure that you have a chance to let us know this.
Shelly, can they unmute themselves? Because sometimes it's better just to start talking. And
They cannot. Okay, so I have a question from Angela. So, Angela, if you want to go ahead and ask your question, you're unmuted.
Hi. I was just wondering if this is the same study that we participated in April.
yes, it is. So you can speak well to it, probably.
I can. My youngest will be 8 in June, but he's got a heart transplant, so won't be eligible for this study, right?
Right.
Now, Ben has turned 18. Would he be retested again as an adult?
Probably not, because we'd be looking at his data twice then. So, it's just a really good question. Now, would we do that extra day with him? But probably not at this point. But you could, if you have any comments or anything about your experience, you brought the whole crew. It was fun.
Did.
So
we did. It was a really great experience. Not only was it well planned and well choreographed, especially with three boys going through the process, but we were able to also go out into the community and go to the zoo and do different things around and explore St. Louis, which was really an amazing treat as well.
great. We try to be as accommodating as possible for families to come. I know we have other siblings and things like that, so even if you're not sure about something and you have, just please ask us. We try to make every effort to get you here, so financially and otherwise.
We have another question. I'm going to mute Angela and unmute Brian so he can ask his question. Brian, you're unmuted.
Hi, Todd. This is Brian.
Hey, Brian.
Hello.
I feel like sports radio. First time caller, long time listener. Right?
We can hear you, Brian. Or not. I don't know.
I heard him for a second.
Yeah.
Ask him to type this question then.
Well, he can hear you. But Todd, while we're waiting for Brian, the one question that I think that has come up before is with regards to female siblings. I know you're looking for siblings and friends to participate as controls. My understanding is you're looking for male controls. Is that correct?
Yeah, great question. So we're only looking for male controls. There are just inherent differences in metabolism between females and males. So we're trying to limit as many confounding variables as possible. So we're only studying males.
Okay, thank you. We're still trying
Hey,
to.
Todd.
I heard somebody.
Hey, Todd. This is Brian.
Hey, Brian.
I was wondering if any of the information gathered from this study is going to be inputted into the repository.
It's a great question. The answer is I don't know. So basically we have we're collecting plasma, which will have for sure leftover plasma for after we do the analyses. And we're also doing, originally we were going to collect skin biopsies. However, we were able to, over the last year and a half, generate this technique where we collect urine. And so basically renal epithelial cells, so basically cells from the kidney that gets excreted in urine, and then we isolate these cells, and we're in conjunction with guys here at our core lab and Barry Byrne is turning them into cardiomyocytes. You've heard of pluripotent stem cells. Well, that's basically what we're trying to do. So if we are able to generate enough of these cells, then that could certainly be a possibility of storing some in the repository.
Brian, this is Matt Talk. We are supposed to have the first Barth syndrome iPS cells ready right around this time. They've been delayed for several months due to some technical problems. And if Todd could develop the technology or get the technology to work for what he just said from urine samples, that would greatly expand the number of cells or iPS cells or induced pluripotent stem cells. So that's fantastic. Any part of the data that Todd doesn't publish, I am sure we'll put it in a format so that researchers can look at it in the biobank in the database for Barth syndrome. So that was a great question, and I'll make it a point to make sure that we have a space for it. But I think Todd's first thing is to explain what an iPS cell is. iPS cells are called induced pluripotent stem cells, and what they are, many times you can get a skin cell, sometimes called a fibroblast, and that cell is tricked into becoming what's called dedifferentiated. Through certain techniques in cell culture, you could turn that cell into a cell that is very, very primordial, or a cell that can give rise to many different types of cell types. And of course, one of the interesting ones is a heart cell for Barth syndrome, for Barth syndrome research. And that is revolutionizing a lot of our understanding of diseases, because one of the limitations in working in researching human diseases, getting samples that are able to be characteristic of that disease. And this iPS cells, and you probably heard of them, they're called stem cells in other aspects. These stem cells allow us to look at what goes on at the cellular level, let's say in Barth syndrome. It could be for any disease, but obviously for Barth syndrome is what we're interested in. And it could lead to great and quicker advances on understanding. But what Todd does here is even more valuable than that, because Todd is looking at the whole individual as opposed to a single cell. And I think you got to recognize that this is a very it's a much more difficult but very, very valuable research that he's doing. And all this feeds on one another. And the research that's done, that Todd does, and the output from what Todd does will feed other researchers' efforts. And so we'll probably understand Barth syndrome a lot faster than we would otherwise. So that's a long-winded explanation for what iPS cells that I saw there.
One extra advantage of these iPS cells is we can study these cells because they have the genetic defect of tafazin, and it's a lot easier than going in and getting a heart biopsy. So that's one of the big advantages of studying these cells.
Yeah, nobody wants to take samples of your heart if you don't have to, and so that's a great, that's a big advantage. And it's also an advantage when we go and look at see if a therapy is working. We could try it out on these iPS cells before we even give a treatment or a drug to an individual. So that's, there's many things you could do with iPS cells.
Okay, I'm going to unmute everybody for just a second. Let's see. They always sound like we're in a vacuum, but I just want to make sure that if anyone has a question, you've all been unmuted. So if anyone has a question, if you could just let us know. John, maybe I would like to get you to say that. So I'm going to unmute you and I'm going to put everybody else on mute. So if you could just let the folks know what you just said.
Am I on?
You're all.
You're on.
Can you hear me? Yeah, I just typed. Jack and I were just attending this, and Jack said he'd be more than happy to speak with anybody about Dr. Cade's study. He has nothing but great things to say. He also very much enjoys St. Louis. And I think Todd actually made him a St. Louis Cardinal fan, which doesn't sit well in this house. But
It's better than being a Mets fan. It's a lot easier than being a Mets fan.
you're right, Todd. You're absolutely right.
Oh, only to you he would say that, Todd. Only to you.
Well, I'm a Phillies fan. It's a lot easier being a Cardinals fan. I wish I could fully convert, but I can't.
But
My
yeah,
life
Jack,
would be easier.
in all seriousness, Shelley, Jack said he'd love to speak. If someone wants to call Jack and speak live to him, he's actually, I think, participated in 2 of Dr. Cade's studies.
Yes, yeah.
So he'd be happy to speak to any of the guys that had questions.
I appreciate that because I think sometimes families, want to know, they want to talk to somebody who's been through the study. I don't know why they seem to think that the researchers are just going to do something terrible, even though they've got to lay everything out. But I think getting it from the guys, I think, this is the nice thing is we have photographs of what they're going through, and we have enough photographs from the conferences, but also with this presentation that what we're learning is so important, and the research is so important to better understand this disease. So thank Jack for us, and Angela, thank you also for your guys being willing to talk to the guys as well.
Shelley, if I can just say one more thing before I get off the air. While Jack and I are watching, of course, Dr. Cade showed the picture of Jack on the table with the holes in his sock. and my wife Liz is on business in Utah right now. So I took a picture of Todd's picture and texted it to Liz, and she's out to dinner with some business people, and she said, "Oh my God.
Oh God. Why is there a hole in his sock?" Right? Yeah.
Just
like my wife.
Dr. Cade knows Jack, and that's just Jack.
That was a special sock, wasn't it?
That's
that
right.
was a special sock, wasn't it?
Right.
Oh, well, there's worse things. At least they were clean.
There you go.
Got to take up for Liz. Well, I think that's about it. Todd, thank you so much for your time and wonderful explanation. And this is all recorded. And if there's anything that you missed, please don't hesitate to get in touch directly with Todd and anybody who's listening to this call after it's been recorded. We will provide you with Dr. Cade's contact information. He's more than willing to answer any questions that you have. So with that, I'm going to say goodnight unless there's anything else.
Wait a second. If everybody wants to ask me anything too, I'm going to be the biggest cheerleader to help Todd get this study done. So please, if you got any question that you think I might help, put some input into, contact me anytime. I'm here 24/7, 365 in a basement in New Jersey. So I ain't going nowhere.
And for the people who may be watching this video call and not know who's talking, that is Matt Tott, who is our director of science. So
and Shelley, this is John Higgins one more time. If someone has a question and one of the Barth guys want to speak to Jack, just have them contact you and we'll get Jack's cell phone number and they can speak live to him.
Thank you. All right, folks. Thank you for your time, and this has been a very good meeting. Thank you, Todd.
Okay, thank you, everyone.